first address one of the things you said, which is not accurate. You said we're not going to have any more providers. The entire third, the last third of this bill deals with workforce development issues, including how we train and educate more healthcare providers and get them into areas that are underserved. But one of the problems we have right now is that the healthcare that's being provided can be very inefficient in certain parts of the country. Because medical economists who look at how we spend our healthcare dollars will tell you that between $500 and $700 billion is wasted every year in the system, primarily in certain geographic parts of the country that are at the highest ends of Medicare reimbursement and the lowest end of the quality spectrum. And I'll give you a very concrete example of this. If you are a patient in Los Angeles at Garfield Hospital, Medicare spends about $110,000 in the last 2 years of your life treating you. If you're that same patient at the Mayo Clinic in Rochester, Minnesota, Medicare spends about $33,000 a year taking care of you over the last 2 years of your life. Now, medical economists will also tell you that those last 2 years and how we spend money on healthcare is where much of the inefficiency takes place. And you can see this just in regional differences. Most people in the Midwest, including Iowa, when they're at the end of their life, they want to spend that time with their family. They want to spend it in their homes or in a hospice setting. They want to try to they want to live the rest of their life with dignity and respect. And yet in some parts of the country, and I've seen this and I've heard stories from doctors and nurses in my district, where they have a patient who goes off to Arizona or Texas or Florida during the winter, and they come back and they've had all these medical procedures done that their primary care doctor didn't even know about or think was necessary. And there's been stories of people who in the last 6 months of their life are having hip replacement surgery even though they've got a terminal cancer. So one of the things we're doing is we're wasting a lot of money, and that's building inefficiency, and it's driving up the cost of healthcare. So by changing the way that we provide patients access to primary care, reduced waste and inefficiency, it's going to have a lot more dollars available for legitimate healthcare needs.